Okay, thanks very much. We're going to go straight into a set of Q&A rounds now. I'm actually going to kick it off with a question that's come in from somebody listening online, and then we'll open the floor. There'll be roving microphones so that people listening online can hear your questions. And please tell us who you are and where you work, or if you're an independent consultant and so on. The first question is from Mariana in Luxembourg. She's got a question for Isabel. She says that you've portrayed universal transfers as a better option than targeted transfers, but she's asking, is that really the best investment for protecting the middle classes? Aren't there other things that would be more affordable and better and more effective, for example, changing labour market policies? Can we have a show of hands? I'll take a couple more. The gentleman there at the back, and then this lady here in the middle.
Thank you very much. My name's James Thornbury, and I work for an organisation called Sense International. We work overseas, obviously, in disability. A number of you have touched on this point, and I would like to know whether whether you have specific evidence. In disability, we are increasingly vocal and engaged with social protection, but there is an argument, a counter-argument, that says, actually, if the disability sector engages with social protection, it will mean that the state will not assume its responsibilities to ensure that there is inclusive education, there's inclusive health, etc. So a pernicious negative effect. And that debate is quite strong. Is there any evidence that that is an unintended side effect?
I'm Claire O'Brien from the Social Protection team at Oxford Policy Management. I and my colleagues have spent some time over the last few years supporting various countries around the world to develop national social protection strategies. And I was very impressed to see the stance in favour of the universal coverage that was taken by the ILO and in this report. And I wondered to what extent you felt that when you try and apply that in practice, there might be an ideological struggle with the World Bank, who are working in very similar countries and specifically advocating a targeted approach to the extent that it seems to be confusing governments, because they feel that when one donor comes along, they get one story, and when another one comes along, they get another. I'm thinking specifically of some work we did in Congo-Brazzaville, where we did some simulations that demonstrated that they could achieve universal child benefit for under fives, an old age pension and a disability allowance. And then the World Bank said that they would fund the follow-up work to implement the social protection strategy, provided they changed their mind and said that they needed poverty-targeted cash transfers.
Interesting. Isabel, they're mainly directed at you. Would you like to have a go at responding to some of those?
Yes. Well, first of all, I would like to sincerely thank all the commenters, because they have been such positive comments. So really, thank you very much. On behalf of the whole team, I don't need to tell you this is a team effort. It was, well, for ILO, a large team. It was not such a large team. Actually, at the end, there was very few individuals. But we all worked heavily day and night, really, for a few months to produce the report. So thank you very much for your comments. I actually learn a lot, and I take note also of future areas that need to be developed. And let me just focus on a couple of comments, though, that I think they are interesting perhaps for everybody. The emphasis on social justice is also an emphasis on rights and having social protection as a right. And this is enshrined in ILO foundational documents. You read the Declaration of Philadelphia, which was done, by 2 generations earlier than us. It's so powerful. It's unbelievable. It is really, you read it, and it has transmit the power of social justice and the importance, to act against, greed in societies and others. This is phenomenal. So, ILO has a tradition to work on that and to focus on rights. And that's why the emphasis also on legal systems that will also have, just not any cash transfer linked from a legal system, but trying to embed them, into laws. that protect citizens. On the informal sector, I cannot agree anymore with Frances. You are completely right. Actually, we have done massive efforts to include as much as possible on the informal sector, but this is the challenge of our generation, really. And to let you know that in ILO we have 9 priority areas. Social protection expansion is one, but another one is what we call formalization of the informal sector, and we are putting a lot of emphasis and attention on how can we bring people that are at the moment, part of this informal sector, how can we make it work. There are a number of strategies. We're looking for evidence. I invite anybody here that has evidence to please send it to me, because now this is frontier work. But there are many things emerging, and one of them is that it appears to be very feasible to start expanding by sectors. Like, for instance, domestic workers. Domestic workers is relatively easy to start, applying legislation to include them as part of a social protection system. And likewise, you could think, could be fishermen and others. So that is one way. There are other ways, and evidence is appearing from other countries. As always, the country experience, as Sam was saying, is all. And it depends a lot how a government is, the philosophy, and how committed they are towards social protection. And virtually you can do changes overnight, and if a government is committed to the topic, and if they're not committed, then it's always the progressive realization that might take who knows how long. On the questions done, actually they were both very similar. One talking about universalism versus targeting for middle classes. So if middle classes might not need some other policies. And the one for a colleague from Sense International also saying if disability, if it might not be better to choose other policies instead of social protection for persons with disabilities. Well, the key thing, social protection is a sector investment, and it needs to happen with many other sectoral investments. It's not one or another. It must be complementary and going in parallel. You don't do social protection and stop education or health or universal design in architecture and infrastructure. You don't need to do them all, and governments do need to face them all. So I will not ever suggest that social protection replaces others. This is about all working together with different sectors and expanding them all in a manner that is equal. And finally, the note about the targeting and versus universalism and World Bank and UN approaches. Well, the United Nations is certainly for universal schemes, okay, because they're linked to human rights, because it is a right for all and not just for a few. Though certainly you do, in situations where you have, people with poverty in poverty or multiple deprivations, you will clearly start by those first. So that is perhaps the entry point. Let me add that the World Bank and the international financial institutions, they're actually quite divided. It depends who you talk to. Not everybody is the same. So in some cases, yes, there will be absolutely for targeting and there's no way out. And in some others, it's not. In some others, actually, they are embracing universal approaches. And let me tell you, in health, it was phenomenal last December in 2013 when President Kim, declared that officially the bank and WHO are working together towards universal health coverage. That was unthinkable only a decade ago. And now suddenly we got it in health. So, we could think the same for social protection. Thank you.
Okay, shall we take another round of questions? Anna, then the gentleman over at the back there.
Thank you. Anna McCord, ODI. I wanted to add my voice to the congratulations. I mean, it's a wonderful resource, and I think there's been a real need for a resource which could be the reference document. And I think this plays that role, which is immensely useful to all of us working in the field. One thing I wanted to mention that you hadn't mentioned was that there are a whole series of data tables associated with the report. So as well as having the analysis, there's actually very, very rich sources of data that people can use themselves to carry out their own analysis and to explore some of the issues raised in the report. And I thought that was a really very valuable addition. And I just had a couple of of questions, really. One is that I think that the report focuses quite appropriately on legislation and systems. And I think what would be interesting in taking it further is looking at the content of the provision in many contexts. And I think a lot of the headline figures are driven by big developments in places like China, whereas if you look on a regional basis, you've got very differentiated figures. So I think there's just a need to be careful when you take messages from the headline figures. If one's reading a report, it's important to actually look further and then look at the differences by region. And particularly, I think there are two questions which perhaps aren't addressed in the report, and of course you can't address everything, but I think they're important for thinking about in the future. And one is this question of coverage and exclusion errors, coming back to Francis's point. Because if one's looking across the formal and informal sector, even in countries where you have legislation, you have systems in place, effective coverage, if you're looking across the whole population, is extremely low in many low-income countries. And I think appropriately the report is very celebratory, celebrating the achievements, but actually there's quite a bleak picture if you turn it around and look at it from another perspective. And similarly, there is an explosion of provision, but the other critical question is what's not only coverage, but also what's the level of provision in terms of the value of transfers. And there's been some very interesting research coming out recently, which has seen that some systems have been initiated, rolled out nationally, but actually the transfer level is so small, it's not necessarily having a significant impact on poverty. So I think those questions of coverage and then the value of the transfer are also critical when one gets beyond looking at the legislation and systems. Thank you.
Thank you. Matthew Martin, Development Finance International. Just to add my voice to the congratulations, and particularly as a person who knew virtually nothing about social protection before reading the report, it's a really readable report for people who are novices like I am. Thank you also for using in the report some of our government spending watch data that we put together with Oxfam, tracking what people are spending. But I was interested by your interpretation of what's happening in low-income countries, and my feeling is that the positive stories that you're telling in the report are a bit the exception rather than the rule, because we work with about 50 low-income countries on trying to work out what they should be spending and trying to track the spending, and most of them are telling us stories not just about the World Bank, but about the whole donor community regarding social protection very much as an afterthought compared to health and education. If there's ever a choice to be made, money needs to go into health and education. You see that in the IMF only trying to protect health and education spending generally in countries rather than social protection spending in low-income country programs. And I was wondering really, I was hoping you had some positive news to tell us about perhaps that perception in the donor community of social protection as the poor relation changing. I was wondering what the reaction has been to this report from the donor community. I mean, the government in this country, for example, cut off its money to ILO a couple of years ago. So I was wondering whether you think that's kind of maybe changing back in another direction, and therefore you're optimistic about how donors will contribute to the post-2015 agenda, because otherwise we're setting ourselves up for social protection flaws as a goal with no money. And certainly we've been looking at the aid numbers, virtually no donor money is being spent on social protection at the moment. So, and particularly the type of social protection you're talking about as opposed to disaster risk reduction type social protection. So perhaps could you comment on that political climate and whether you think it's changing?
We've got time for one more question in this round. No? Okay.
Well, thank you again for the positive comments. And let me expand a bit what Anna McCord said. And you're completely right, and I should have mentioned, actually, just to try to be useful, we put all the data it's downloadable in Excel files, so that, it's useful to be used in different manners. Not only that, we have lovely links that I hope they all work, because as always, and you can link to the maps and actually just create your own maps and use them and adapt them and all that. So the idea was to do some user-friendly documents so it could be used for reference and for others. And if you find anything that does not work, let me know. So, as always, there's some broken link and all that. To Matthew was a very interesting question. This theory of leaks of low-income countries is a history of expansion too, but the problem is that they're very, very targeted safety nets with very, very low income level, low benefit levels. So it's well, it's positive, but of course much lesser than we wanted, and particularly given the situation of low-income countries. With respect to the donors, this is a very interesting question. Donors are important, particularly, of course, for low-income countries, because for middle-income countries, it's more of an issue of policy dialogue. Middle-income countries actually do have the resources, and actually they have enormous inequalities. So it's mostly an issue of how do they organize their own development policies, so they expand or not social protection, depending to to the internal policy discussions of the countries. But for low-income countries, certainly donors do matter a lot, and particularly for fragile states and others. So, well, I cannot speak about the British government, certainly. With regards with others, well, they listen. I have not heard any particular thing. There seems to be the interest continues to be on providing support to low-income countries, so I have not heard anything otherwise about that. But, very often there is a mismatch between intention and what really happens in the field. And as you're saying, at the end, the power of institutions like the IMF. So a lot of IMF reports, they identify poverty reduction with targeted approaches, Now, this is very peculiar. I recall even a case of Togo. In Togo, there was an advice to target benefits to the extreme poor in rural areas. This is a country where poverty levels are about 70% of the population. So you see, the arguments for universalism are so huge, and also how you identify the most poor in rural areas where everybody virtually have very similar standards. So government officials are aware about that, and and this is how the discussion goes. And very often it is about fighting country by country, And I'm sure we are all there, making the case in different manners and through different fora. And yes, and that is going to continue. Though, look, on the positive side, it's a story still of expansion, and no matter low benefits, but still. This is ongoing, so it's about picking the trend and keep moving it.
Thanks, Isabel. I'm just going to give our discussants a chance to respond to some of the things that have been raised by the questions from the audience, but also some of the responses that we've had from Isabel. I don't know if any of you would like to go, Francis.
Yeah, just a brief comment on targeting. I mean, in a way, any benefit, even if it's described as universal, is targeted, because it depends how it's designed. You have very low quality health clinics for everybody. Are your middle classes going to use it? So that I think they're all targeted. And I think one thing one wants to, in the debate, say with the World Bank, get away from monetary targeting, because that's nearly always incorrect and you're not reaching the right people. But there's a lot to be said for some of the regional targeting, or targeting by age. I mean, pensions are targeted by age, and children's benefits are targeted by age. So I think you can design your schemes cleverly in such a way that they're not going to be excessively expensive, and a whole lot of people who are privileged are going to get access, but yet not use this sort of narrow form of targeting, which is very dysfunctional.
Thanks, Sam.
Yeah, I think that's exactly right, and I think that plays well politically at national and local levels as well. It doesn't make a lot of sense in situations of fairly mass poverty to start pulling apart the bottom couple of deciles and targeting one group or another. The vulnerable group discourse seems to work a bit better locally and nationally. I mean, the ideological struggle that was raised here between the ILO and the bank, that's one part of it, but I think the bank is quite divided on this. The biggest struggle is with the ministers of finance in low-income countries, and persuading the minister, the PS, the Secretary of the Treasury, they're the tough ones. They're the ones with the purse strings, and they are more neoliberalised than most people in the World Bank very frequently. They were trained by the Washington Consensus guys, not the post-Washington Consensus guys. So that's a struggle, and it's not clear to me that the arguments in this report and arguments we all use, that it's good for growth and good for social justice, either of them wash very well in ministers of finance. They don't buy the growth story, and the evidence could be stronger, couldn't it? And the social justice stuff is, these aren't social movement advocates for So, you know, the ways in which governments have been persuaded to take things on are usually via political logic, and sometimes along with picking vulnerable groups who people see as being deserving, often older people, but not the types of arguments we might generally make off the academic shelf.
Thanks, Sam. Francesca?
Just very briefly, I think I'm just following up on what Francis has said and others have pointed out, is that we at this point know quite a lot actually about what works in social protection. So we know in terms of the effectiveness, the design details around the targeting mechanisms, conditionality, if we want to talk about conditionality, benefit or transfer levels, types of transfers, the details around the degrees, for instance, of targeting, the informational requirements, and all the costs associated with alternative design and implementation features. And by costs, I'm referring to sort of administrative financial costs, but also to the social costs and the political economy type considerations, some of which we've raised here, can all be factored in when we consider alternative design and implementation parameters. And these matter. They matter tremendously. The details matter. And some of these arise or are mentioned in the report, but there's much more work to do, I think, precisely around that.
Okay, one really quick last round. Matthew?
Hi, Matthew Greenslade, DFID. Thanks a lot for the great report, Isabel. I feel I should defend donors a tiny bit without being too defensive. I think there has been a big increase in spending in the last decade, including in low-income countries, and quite a lot of risk-taking. And I agree with Sam's point about often ministries of finance being the challenge and the blockage. I've seen that recently in Uganda, where actually the IMF has been trying to get the wider donor community together to lobby the Ministry of Finance to spend more on social protection. I think the challenge now, it's seen in DFID, is building systems which governments can pay for that are sustainable for the long term. And I think this is where the value of the report really comes out in talking about social protection more widely, as Francesca was saying, than cash transfers and public works. Talking about the components of a system and helping to develop a vision for where countries like Uganda can hope to be in 20 or 50 years' time. So it's great from that point of view.
Thank you. Can you send the microphone down to the man sat next to Claire, please?
Hello, Paul Dornan, University of Oxford and Young Lives research study. Thank you for really interesting discussion and lots of very interesting comments. I really enjoyed the fact there's been such a focus on the politics of social protection and also on the exclusion error risks, the non-take-up that you see when you get a lot of complexity around in social protection instruments. So that's great, and indeed it plays into this question about sustaining social protection systems in the longer term, given the need for domestic political support. So that's really, really great. I just wondered, Isabel, you made a big pitch around the expansion of social protection systems in middle-income countries. And obviously we've seen a lot of development around cash transfers in South America particularly. I wondered if you could summarise, from your perspective of having looked across a number of different countries, what really made the difference in those countries in building that political consensus, in building those systems. So why do you think, looking across all of those countries, we saw that expansion?
Thanks. And then one last question.
Yes, thank you. Just to repeat, very interesting, fascinating, etc.
Can you tell us who you are?
Sorry, my name is Neil Webster. I'm from the Danish Institute for International Studies. Just two quick questions come comments. One is, and I think it was only mentioned in the last response, Francesca, and that is the issue of conditionality. I know there's a lot of issue around targeting, which is both political and economic, but also the issue of conditional cash transfers, which I know is also another both highly normative but sometimes very pragmatic way of approaching certain aspects of social protection. And the other comment I wanted to make, and that is that well, the UN is actually a little bit divided because UNCDF is doing a lot of work in piloting of both targeted and conditional cash transfers in a number of countries. So, but I think that's more from a pragmatic perspective than from a, should we say, an ideological or normative perspective, and it has a lot to do with the resource envelope available. But the point I wanted to make was that in looking at social protection, I'm not an expert, but I see many of the ways of implementation don't actually engage the beneficiaries. They don't actually have an interaction with the delivery system. And I just wonder whether or not there is an argument here for a greater role in certain types of social protection for local government in terms of the management, the grievance mechanism, the monitoring, etc. Thank you.
Okay, thanks. Isabel.
Okay. Quickly, actually, Francis' comment was very correct. The problem with targeting, in most systems are targeted. Okay, you target on age or on conditions, meaning being a widow, or because it's part of the life cycle, you say children, you know, or regionally. So it's not about targeting, it's about means testing. Now, means testing, we should not be ideological about that too. I mean, it simply happened because of the focus in the 1990s for poverty reduction, then that became the panacea. And that is, however, where it's a bit disturbing. Because then countries, you know, they learn a recipe and then this is applied. It's the same as in the removal of fuel subsidies. You know, you will say you could remove the fuel subsidies and replace them by a, you know, a social protection system. But no, you always hear linked, and it comes always automatically, you know, removal of fuel subsidy, a well-targeted safety net. And this appears, you know, you can Google it in virtually everywhere. And that's when the problem comes, because you find magic solution. Magic solutions tend to be bad, because you might work in one place well, but not necessarily in all of them. And you, of course, here we are engaged in development, and we know very well that development is all about, you know, different, you know, alternatives and seeing what is the net welfare effects of all of them, and then evaluating that. So that is about that. With regarding, so it's all about systems, and that links actually with the question about conditionalities and the rest. Again, we did not enter into detail into that because it is part of it appears there in the chapter on children, but again, this is because it's looking at all the different schemes. Then the conditionalities are only for one type of scheme, which is the child cash transfers. Well, we know it has been happening. Many countries have done it. Generally, there are a lot of evidence that they don't necessarily work. In my experience, there are countries that they say, because they might get funding from some donor, that they request to be conditional. The reality is they cannot be done because they're complicated to be implemented, you know. So the reality is that in practice they cannot really happen on the ground, but they are called like that. You know, so you have evidence of all. With regards to the political economy, why countries do social protection schemes, or in better case, systems, this is, of course, a you know, very important question. I was trying to explain that at the beginning. There are multiple reasons, and ideally you might want to use them all. Some countries are using it for political reasons, because it supports political stability, because it reduces poverty and you know, gross inequalities. Some others, like the case of China, they are using it to promote domestic demand, simply to raise household income and to ensure that there is, you know, some more consumption at the country level. So the arguments are all different. And this is very important to link to Matthew's question, because it all is all about the vision that a country wants to have about its society in a, let's say, in 15 years. So how would you like your society to be? And that is the developmental question. No? But social protection can play such a significant role in reducing inequalities and all the other aspects that we have been commenting. So that is, I think, where we should place it, as Matthew was saying.
Okay, any last 30-second comments from any of our discussants? No? No. Okay, well, I think we're done. I guess if I've got any takeaways, it's one about us having to think a bit more carefully about how we use that language of universal, that it quite often we don't use it in ways which really are meaning universal. Another one for me about getting social justice back into the way in which we work on social protection, including into the kinds of systems that we use, so that we're not just being technocratic about it. And then perhaps a final one, which is the thing I need to go away and think about, you know, the stuff that Sam has told us about how we can't explain the coverage of social protection using things like democracy or GDP or capacity. So we need to think more about how we do explain what makes this stuff happen on the ground. They're my takeaways. Tell us about yours later or write to us. We'd be keen to hear from you. But that's all from us for now. Thanks very much for your questions and for coming to listen. And thanks, Isabel.
Thank you. Thank you very much.